We are so grateful to Rotary International, to President Jennifer Jones, to the Key Biscayne Club, and all Rotarians for supporting our children and families in our community who have mental health and wellness needs. This program has enabled us to serve children that have mental health needs and concerns. It's a telehealth program that provides immediate access when those concerns are identified.
As an organization of 1.4 million members in more than 200 countries and geographical areas, we focus on a lot of things that ensure that we're targeting the world's most pressing challenges. Children's mental health and disease prevention and treatment are a big part of our portfolio, and so the opportunity to be able to partner with you and to be able to focus on the needs of special children who need help at a very critical time is something that we're enormously proud of.
It's amazing how this did come together. I had the unfortunate experience of losing my youngest son to suicide, and knew that there were a lot of mental wellness issues going on, not just in our community, but around the world. And so when Jennifer Jones asked me if she knew a club that could take on this global grant, and as mentioned, it's always between two clubs, I told her that she needed not to go any further, that it would be a pleasure for us to do it on behalf of the Key Biscayne Rotary Club.
One of the things that I think is iconic about this relationship is that certainly the hospital network has a reputation unto itself. The Nicklaus name, certainly the world's greatest golfer, is someone known, loved, and revered the world over. And our opportunity to have developed a relationship not only with Mr. Nicklaus and his wife Barbara, but to have extended that now to the Nicklaus Hospital Foundation and Hospital Network. I think that it means that in many ways we're sort of one big happy family striving to do good in the world, and with a focus on children, that's our future. And as we imagine what our future looks like, we know that we're looking towards hope and providing that for kids, that they can be the best that they can be.
This program has many great outcomes to showcase, but the one I'd like to speak about is patient satisfaction. It is the voice of the customer, and our patients have expressed satisfaction for the services. The families have reported that this program has really meant so much to them and has provided a lifeline in many ways.
My name is Raul Hernandez. My medical condition is cerebral palsy. It limits me from walking. I could feel comfortable in my own household. I would recommend having the choice of telehealth to other patients.
Telehealth is definitely an important service in our community. We have children that are special needs that have limited access to transportation. They also have limited mobility problems. Some parents still don't have the capacity to be able to get out of work. So telehealth definitely provides them an added benefit.
Some of the most common outcomes that we have after an initial consultation with the child, the adolescent, and family is that they might not need any further services after that initial outcome. I would say the second most common outcome is that we provide them some brief interventions, anywhere between 3 and 4 therapy sessions.
So I want to very much thank the Nicklaus Children's Hospital and all the work they're doing in this arena that is helping just hundreds of kids right now since about a year and a half or so, and we want to expand that whole program. But I also would be remiss not to mention the Rotary International Foundation, and as well Jennifer Jones, who has really promoted to expand this mental wellness program, not only in our community, but is now expanding to other areas. So all these people need to be thanked, and I'm grateful that I can be a part of this program.